Greetings. Now let us understand in today's session, that is outpatient system or outpatient department. Outpatient refers to those kind of patients not occupying beds in a hospital or in clinics or any kind of health centers and other places. Here we can see the patient standing and they are getting consultation charges or paying, or they are collecting the consultation appointment card. So outpatient, there should be a sufficient waiting area, that is waiting lounge should be provided for outpatient. Some banners regarding about the health and health teaching aids will be there. Now, let us move further. The outpatient load is categorized into three categories. One is the emergency, tertiary, and last is the primary care. So, outpatient load is categorized into the three categories. One is emergency, tertiary care, and other one is the primary. Now, let us understand one by one. The emergency, starting. A person has given emergency or accidental care for conditions which require immediate medical attention. So emergency care is such a care where immediate medical attention is required and he has been admitted to the emergency department. He may be suffering from any kind of serious health conditions or illness, trauma or injury, the accidental injury. That is all the emergency situations. Now, let us understand about the tertiary care. Here, in the tertiary care, the patient is directly, he is going to the outpatient department by his attending medical practitioner, because he is going to the outpatient department and he is attending the medical practitioner for specific treatment. It is other than the emergency care or other than the emergency treatment. Lastly, we shall look into the primary care. The primary care is the majority care. The most cases of out of three systems, what we have seen in the outpatient, coming to the emergency, tertiary and primary, the primary is the majority care. It describes a range of service adequate for meeting. Most primary care is used by patients who are ambulatory, that is able to move out freely. So they come to the hospitals, outpatients, the primary care patients with specific ailment, and they come and they go. And they can move, they are able to move from one place to other place, not that much critically ill. Okay, these are some of the outpatient system where it is divided into three parts. We have understood the emergency for emergency care, tertiary care where the department by attending medical practitioners for specific treatment other than the emergency department. Like the specialty care is required, tertiary care teaching hospitals where all the care is there. Suppose the patient has to look out two to three doctors from different specialties. One is from surgery, other is from maybe the internal medicine, another is from the cardiology department. So he goes each and every department and he visits there. That is called to be as tertiary care. And we have seen the primary care, where the majority of the patients are coming to the hospital, the outpatient department are from primary care. Now let us understand the outpatient activity chart, where we can see the medication, that is prescription, is written by the doctor. Then the prescription which is received by the pharmacist, and pharmacist fills the prescription. Later on, dispensing to the patients, the prescription, dispensing of prescription to the outpatients. Then it is divided into two parts. One is the prescription payment. First we will see the prescription payment. The prescription payment, receipt of the payment is given, and cash by cash or any change is required, sometimes change is required, again, the statistics and reports will be done. So it is kept into static and report to the other healthcare providers, and sometimes directly prescription filled. After prescription is filled, whether it is regular prescription file or it is some kind of narcotic prescription file. Again, the prescription filing is divided into two categories. One is regular and narcotic. This is the outpatient activity chart illustration diagrammatically. Now let us move further and let us understand drug distribution to the outpatients. No medicaments should be issued without the prescription. For every medication to be dispensed by the pharmacist, a prescription is required. So no medicines should not be dispensed without the prescription. After the issue has been made, the quantity supplied must be recorded. Medicines are given to the outpatients from the pharmacy, which is situated in the outpatient block. Okay, this is the drug distribution to the outpatient, how it happens. Now we shall move on to the dispensing of controlled drugs and what is the procedures in hospital. Now, responsibility for controlled substances in the hospital. So whenever you are dispensing of controlled drug preparations, it is responsibility has to be taken by the pharmacist for controlled substances in the hospital. Secondly, ordering ward stock of the controlled substances from the pharmacy. Ordering ward stock of the controlled substances from the pharmacy. Third, doctor's orders for administration of controlled drugs. The pharmacist is the legal person and is the authority person to check the orders written by the doctor for the administration of the controlled drugs. So whenever he is dispensing, he has to check the orders and he has to check whether the prescription is found to be valid or not. And no prescription shall not be dispensed without the order written by the doctor. That is prescription. Next, we shall move on to the responsibility for controlled substances. The administrative head of the hospital is responsible for proper safeguarding and handling of controlled substances within the hospital. It's the main responsibility lies on the administrative head. Next, we shall look on to the ordering ward stock of the controlled substances from the pharmacy. A requisition for ward stock controlled substances is completed by insertion a check mark opposite the name, strength, form of controlled substances desired before any new controlled substances are issued to the ward. So we are trying to understand what is ordering ward stock of controlled substances from the pharmacy. You are ordering ward stock, the stock which is reaching to the ward, and that substances are controlled substances which is from the pharmacy, it is going to the ward. How you have to order? First, a request letter for ward controlled substances is completed by insertion of a check mark opposite the name. So the everywhere he has to put the tick mark in front of name, and proper strength is there or not, proper form is there or not, everything he has to check. And before any new controlled substances are issued to the ward, again it has to be brought to the notice of the concerned authorities. So the pharmacist has to check each and everything in a detailed manner before going into the ward, before releasing that substances, the controlled substances to the ward. Here we can see the requisition form for ward stock controlled substances. This is a diagrammatic illustration of the requisition form for ward stock controlled substances. How the request form for ward stock controlled substances, how it has to be made. This is an example. Okay, here we can see the ward, code and date, the particular date has to be filled up. And here you can see on the left hand side number of tablets or capsules in which form it is 20, all the tablets, the quantities here which is written, and here on the below the code, check item needed. The pharmacist has to check, and here we can see the name of the products, the pharmaceutical products. Codeine sulfate tablets, 15 milligrams, morphine sulfate ampoules, phenobarbital tablets. And here on the right hand side we can see the price. The pharmacist is held responsible and he has to check all the things and he has to dispense it. The pharmacist is the authority person who has to check, and he has to fill up the form, request form to the ward stop for controlled substances. Now we shall move on to the next topic, that is doctor's orders for administration of controlled substances. Here doctors, how is ordering for administration of controlled substances, controlled drug products. The following information must appear on the doctor's controlled drug order sheet. These are the following information should contain all these essential things. Okay. Now we shall see one by one. Date, patient's full name, and whenever he is writing the date, it should be noted and it should be brought into notice of the doctors. He has to write the full date, not 20. It is 2020. If today's date is there, 8/08 and 08 2020. Patient's full name, not writing any initials. Complete name has to be written with, so there will be no confusion at all. Patient's hospital number has to be written neatly. The patient's hospital number, unique number. Specific description of drug ordered and strength. He has to write the specific description of the drug ordered and strength of the drug. And lastly, the amount to be given. This is the doctor's orders for administration of controlled drugs. So this information must appear on doctor's controlled drug order sheet. Now we shall move on to the prescriptions now. Now here, in case of prescriptions, in dispensing of controlled substances, following requirements should be always adhered with prescriptions, should be followed. Except when dispensed, there are few things which has to be understood now. So, prescriptions in dispensing of controlled substances, the following requirements should be with prescriptions, as I told you. Except when dispensed, drugs may be dispensed on oral prescription in an emergency situations. Prescription shall be retained in conformity with the requirements of this law. No prescription for a controlled substances in Schedule 2 may be refilled. Controlled substances in Schedule 3 and 4 may be dispensed a written or oral prescription in conformity. Okay, these are some of the guidelines, I should say some of the guidelines in dispensing of controlled substances. And the pharmacist is held and he has to follow the guidelines. These are the requirements when you are dispensing the prescriptions. It can be dispensed with oral prescription. If doctor is calling to you, this is the thing, in emergency situations only. And prescription shall be retained in conformity with the requirements of this law. And he has to retain that prescription. No prescription for controlled substances in Schedule 2 may be refilled. Okay. Now we shall move on to the most commonly abused prescription drugs. The most common drugs which are meant for the patients are using like a drug abuse. They become addicted. It's called to be as drug abuse. They use prescriptions, and sometimes, most of the times, they become addicted, and they use unwanted, unindicated, I should say. This is called as very problem of concern called as drug abuse. Now we shall see now pain relievers like narcotic analgesics like opioids, narcotics. They relieves the pain. Okay. Oxycodone, example oxycontin, Percocet, hydrocodone, codeine, and morphine. They are all narcotic analgesics, which is mainly given for reducing the pain. Central nervous system depressants like sedatives, tranquilizers, hypnotics, barbiturates, example Nembutal, and benzodiazepines, example Valium and Xanax. They depresses the central nervous system. They are used in psychiatric conditions. They are using for abuse. Stimulants used to treat attention deficit disorders, narcolepsy, and weight loss. The example of stimulants, dextroamphetamine. The example would be dexedrine and methylphenidate. Example is Ritalin. See, all these, whether it may be the pain relievers, whether it may be the central nervous system depressants, whether it may be the stimulants used to treat attention deficit disorders in case of narcolepsy and other conditions, the patients are using drugs. They're using it unindicated. So for all these kind of things, a valid prescription is required, and pharmacist is nowhere to dispense the drugs without a valid prescription. It becomes the fundamental responsibility on the pharmacist that not to be dispense such drugs which are narcotic drugs. Let us move further, and in next video we will see the satellite pharmacy. Thank you.